Welcome everyone to today's SHIP Lean webinar. The instructor, John Roberts, is going to be speaking about Introduction to Lean Tools. And this is the second webinar in the SHIP Lean Healthcare Training. And John Roberts is the CEO and President of Midwest Health Consultants. And he has been leading the SHIP Lean training through Moodle and webinars. So I'm going to go ahead and turn it over to John to share his PowerPoint presentation.
Thank you, Leslie. Good afternoon, everybody. We're excited to have you back here for the second webinar in our series. Today we're going to be covering, as Leslie mentioned, some of the lean tools that are available to folks who use the lean thinking methodology. And we're really going to be flying over these tools around 10,000 feet today. When I teach Lean Six Sigma Green Belt classes, we would spend probably 2 days on these topics that we're going to cover today. So we're going to breeze through it pretty quickly, but hopefully we're going to give you a good overview of what I think are the key lean tools that you can use from the Lean Toolkit. So our agenda for today is to really kind of do a little background information on the lean tools, kind of bring you back up to speed from where we were from the first webinar as to what some of the things that we're trying to accomplish when we're looking at implementing lean methodology in our organizations. Now we're going to take a look at 4 specific lean tools, the value stream mapping, 5S, which is a worksite organization, A3 problem solving, and standard work. Those are 4 tools that, again, we'll delve into in a little more detail, although there's much more detail that goes along with that I will supply you through Moodle here at the end of the week of more details into these specific tools. Then we'll finish up with how to identify and initiate your lean project or Kaizen event, and we'll talk about some of the things you need to look at as you prepare to do your project over the next 60 days. Just a reminder of some of the lean principles that we talked about last time. The main principles in lean thinking are 1, and hopefully you got a good exposure to the first one, which is eliminating waste. Hopefully the waste walks that we had you do over the last month or so opened your eyes to see your organization differently. Hopefully it was a great experience to be able to see things in a different light, whether it's the waste of transportation, inventory, motion, over-processing, you name it. Those are the things we wanted to get you exposed to so that you could see how rampant those things are in a lot of our organizations. And I think that's the first step in really identifying and understanding how to apply lean tools, is to look at what type of waste we're looking at, what we're trying to do to eliminate it or reduce it, and which tools might work best in trying to solve some of those issues and problems. We obviously want to improve workflow, optimize our inventory, change the culture, as we talked about last time, to support lean thinking. We definitely want to look at the customer and the voice of the customer. We talked about that. To better manage our time. We've got folks in hospitals that are really busy, but unfortunately, if the statistics bear it out, 30 to 35%, maybe even more, of their time that they're busy is in activities that really don't add value to our customers and our patients. And again, one of the principles is we want to begin to look at designing flow and systems, and we'll talk about that in the value stream system, to really design our processes so that we can avoid mistakes and to try to take some of those mistakes and reworks and other issues that are wasteful out of our processes. And again, finally, we want to focus on what services and products really meet our customer demand and making sure we're keeping up with that. So again, our guiding principles in Lean are just looking at value. We want to make sure we're providing the best value we can to our patients. To be able to do that, we need to be able to identify the value streams in our organization that are producing that value. To do that, we have to look at flow and pull, and again, looking at constantly perfecting our processes as we move forward in our organizations. If you've looked at Lean and reviewed it much at all, you know that there are a plethora of different types of tools that can be used in Lean. And again, we're not going to have the opportunity to go through all of those, but we'll go through some, I think, of the most critical tools that can be used in your organization. What we found in some smaller rural facilities that we've worked in is that because there's so many different types of tools that can be used for different areas and improvements in your hospital, that some people just kind of tune out and find it overwhelming to be able to learn all those different types of tools. Hopefully we'll break down some of the mystique here of doing that and get you tuned into the tools that probably can help you the most in your organization. And as you might imagine, the 4 tools we're going to cover today I think can relatively solve 95% of the issues that you have in your organization. Those tools being, as we mentioned, A3 problem solving, the 5S process, standardized work, and value stream mapping, which in this particular slide looks at current state and future state. So again, that's where we're focusing on these 4 tools. But a lot of the other tools will come into play when we look at and develop these different tools. For instance, if we do a 5S project, we may look at Kanban, which is an inventory management system. We may look at a pull system or visual workplace. Those tools we will pull into a 5S project. So you'll see as we go on that these are the basic 4 that will really get us, I think, again, to be able to resolve a majority of the issues that you'll face in your particular hospital. So let's jump right into an introduction on value stream mapping. Wherever there's a product or a service for a customer, there's a value stream. But the real challenge lies in how do we see it? How do we identify it? And being able to do that and look at the sequence of tasks that are involved with that particular value stream. And so value stream mapping is very, I think, beneficial to being able to look at our processes, being able to identify the processes within those the steps within those processes, and then look at how that flows throughout the organization. So what is a process? A process is a set of conditions that work together to produce a given result. It includes inputs, outputs, transformation, and feedback. And if you remember last time we talked a little bit about the SIPOC model, again, which is looking at the bottom graphic there, looking at our supplies, the suppliers we need, what kind of inputs, the actual inputs making through the process, which produce outputs for our customers. And again, producing what they need and what's valuable to them. A process has to have 4 criteria. It needs to be recurrent. It has to affect some aspect of organizational capacity. It has to be, it can be accomplished differently so to make a contribution to the customer and or the profit of the organization. And finally, it takes coordination between different people throughout the organization to make that process happen. The value stream then is really a set of these processes or activities performed to transform these inputs or products and services into what's required for the customer. And so when we look at value stream, we begin to look at, again, how our value stream is designed, what type of information flows throughout that value stream, what kind of equipment, supplies are needed in those specific steps within that value stream to produce what our customers need. So we begin in the value stream mapping to look at the element of time in the value stream, looking at time and what we need to do to be able to produce and meet the requirements of our patients. And so we begin to bring the time element into that. We begin to look at flow. We begin to look at how many handoffs we have, how many breaks or bottlenecks there are in the value stream. And again, we begin to look at information flows in every direction. How many times have we been in a process where we get to a step in the process and we don't have the right information either from the downstream parts of the process to be able to do our part? And we find that a lot in working in a process that covers several different departments and making sure that each step of that process or each department has the information they need. They're passing it along to the next person in the process to be able to do their job and, again, create flow throughout the organization. So, again, a process is a set of steps that transform one or more inputs to outputs, and the value stream is a set of those processes, again, which results in the delivery of a service or product. So value stream mapping really is a tool to help optimize the elimination of waste in our processes. And we basically begin to do that by looking at what's the current state of our value stream. What is actually happening in our particular process throughout this organization. And I can guarantee you through the work I've done with different organizations, what people think is the value stream or the way things are being done is many times considerably different than what's actually happening in that particular value stream. So first of all, we have to map what that current value stream is. What is actually happening? Where are the bottlenecks? Where are the breakdowns? Where are the flow being restricted? Once we identify that, we can begin to use some of those lean tools we talked about or identified there earlier and apply some of those things to be able to develop what our future state map is. And basically a future state map is if we could redesign this process to be as flawless as possible, how would we make that look? And so we'll talk about more about those specific steps here in just a second. The purpose of value stream mapping is really to see the flow. And one of the reasons I love it and think it's a really valuable tool is we begin to look at the flow through a graphical representation of how the value stream mapping tool. And again, it's a graphical representation, and one of the things that I really think has been a powerful tool in part of Lean and Lean thinking is making a lot of the things we use, as you'll see throughout the 4 tools we've talked about today, is making things visual and making these things able for people to really get a visual cue at, instead of just reams and reams of policy manuals that have a lot of words in it, but not a lot of visual cues for our folks. So that's really what value stream mapping does. It, again, helps us capture our current reality. It helps us define value from the customer's perspective. I think that's one of the important parts of value stream mapping is really looking at what are we producing for the customer, and what are these process steps in the process? Are they adding value to the customer, or are they non-value added to the customer? Again, it forms the basis for our implementation plan. When we go through a value stream mapping process, we pretty easily can identify some of the major bottlenecks, breakdowns, waste in the system. So this gives us a basis to start creating that new future state map where we can eliminate those waste gaps and the major constraints throughout the process. Again, we want to look at begin to look at a systems perspective of looking at the value stream, regardless of what department it might fall into. Sometimes we use what's called a swim lane value stream map, which shows, again, which departments handle which parts of the process or the value stream in that particular process. And again, we begin to look at and include the time element in basically when and how fast should we be able to produce this particular product or service to our customers. Again, we're looking at value added, non-value added. We want to begin to look at how we can standardize and improve that process. We'll talk a little bit more about that in this standard work process. And again, our ultimate goal is to eliminate waste in the value stream mapping. Why is it so helpful? Why is it such a great tool? Value stream mapping really helps us, again, visualize those connections, interaction, flow of the patient material and information, and begin to look at those and how it flows throughout the organization. It provides us a way to easily identify waste and eliminate it. It usually identifies the constraints or bottlenecks that we have. How many times in your hospitals have you had one department change a procedure or part of the process which they thought would improve their part of that particular process, but complicated things for folks downstream in the process, which actually added a bottleneck further downstream. So when we look at value stream mapping, we're again looking at a systems perspective and making sure we have everybody in the room represented who has a part of that particular value stream. And again, that helps employees not begin to understand not only just their piece of the puzzle, but begins to give them a systems perspective of how this works throughout the whole organization and what their part is in that particular area. And again, through value stream mapping, we begin to identify waiting and cycle times and other time elements of trying to get things through the system. So how do we look at value stream mapping? What kind of, how should we apply it? When should we apply it? Value stream mapping is probably a little more technical. We use it more for larger processes and larger flow throughout the organization. Usually we use value stream mapping when we're looking at high volume products or services that we're delivering. We look at it when it's strategically important. For instance, we may look at it through medication management, making sure we're eliminating medication errors. Obviously, that's strategically important to us as providers and the patients. We look at high revenue or expense impact. We look at other issues that have been recognized as problematic. I'm always amazed at how many times I can go into a facility, ask them to identify, a bottleneck or a problem that's been pretty consistent, and they can many times say that they've had that problem for many years. And again, value stream mapping helps us to be able to look at that. We use high-tech technology when we're doing value stream mapping. We use the high-tech post-it notes when we do value stream mapping, as you can see here from the cues. We do that for a specific reason, is when we're going through and looking at what our current state is, how things are really done today, we're always looking at moving some particular steps in the process around. There's things that people may forget or may not recognize, and so when we do it with Post-it notes on a long sheet of paper, we're able to rearrange those things and really get it down to where it is, where it reflects the current reality. And so on the particular graphic you have in front of you, the picture, you'll see the yellow Post-it notes can be a step in the process. You can see the pink ones may be areas that we know we can find solve problems or solutions right away. You see the blue tilted diamonds. That's a decision in the process. So again, there's a lot of simple ways we can put together our current value stream map. We usually have a team that works on a value stream mapping process, usually anywhere from 3 to 8 participants that all represent different areas of the hospital in that particular value stream. So if we're looking for the admission to discharge process, we'd have the admissions department, the nursing staff, we'd have discharge planning, we'd have other folks that are involved with that. So the main concept here is really looking at making sure we've got the right people in the room that are representing all areas of that particular value stream. And again, we have a value stream leader who's going to go through this, lead through the process and really lead the team in looking at things like end-to-end scope of the value stream, making sure that we are getting the voice of the customer infused into that process of what they want, what they consider value in that value stream, looking at the sequence of activities in that particular process, so ways to eliminate or reduce overprocessing. We're looking at the data that we need to gather in that particular value stream, whether that's time metrics, whether that's looking at patient or staff satisfaction, and other lean metrics that we'll talk to you and show you. And again, looking at the entire process to the final step of delivery to that particular patient. One of the tools that we talk about in lean thinking is Gemba, or Gemba walks. And that's, I think we shared some of that information with you in the waste box. But really, Gemba is the Japanese word for going to where the activity takes place. And so when we're looking at value stream mapping and we're looking at developing the current state map, we're not sitting in some board or conference room putting down the process as we think it is or how it's really stated in the policy manual. We're really going to be taking a look and working and going to that and walking through that as the patient goes through that process. It's really the most effective method of gathering accurate information about the process and really how it's done. And what we find is when we do that, we may do several Gemba walks. We may do one in the daytime, one in the evening, one at night, one on weekends, because I can guarantee you that the process varies and sometimes significantly by different people who are doing that particular process. And so we want to capture as much as we can what's actually happening so that we can make corrections to that. Again, we want to involve the whole team in that. I want to actually walk the process and see when the materials and information come into that process. To get started with the value stream mapping process, we want to clearly define what the boundaries are. We want to make sure we're not taking on something that can't be completed. So we may sometimes break up lengthy processes into smaller, what we call loops, so that we can take those in bite-sized pieces that we can actually work with. Sometimes when we take a specific process and that's fairly complicated and fairly long, if we don't set boundaries for that of exactly what we're doing, what happens generally is we tend to pull in more and more things because it's such a complicated task that when we get to a certain point, sometimes it can be overwhelming. Again, we want to define what value is in the process, and we define that value from the customer's perspective. Again, we want to identify the task and flows and information that's needed for those particular spots in the process. We want to identify any resources that are needed for those places, tasks, and then we create the current state match, but shows exactly where we are and what we're doing. And then we want to begin to visualize the ideal state. If we could, again, wipe the slate clean and make this process flow better, what would it look like? And that's really beginning to create that future state map. And again, developing action plans and tracking so that we can get from our current state to our future state and look at making sure we're eliminating that waste, providing better value, and making sure that whatever solutions we put into place are actually working. So here's an example of a current state value stream map for a patient office visit. You can see the steps in the process as we go along. We see information coming from the EMR. The boxes or the bursts that you see on the top of those particular steps in the process are what we call Kaizen bursts. So those are really things that are the low-hanging fruit, things that are wasteful that we know we can eliminate right away. They're kind of no-brainers. And so again, towards the bottom, we see we're beginning to look at time. How long is the patient in reception? How long are they waiting to get in to see the nurse? How long are they in with the nurse? Is non-value added time, and you can see there that in this particular situation, about 60% of the time was 45 minutes was non-value added to the patient. So those are the things we begin to look at when we do value stream mapping. The next step is designing that future state map. Basically, again, as I mentioned earlier, if we could redesign this whole thing and make it flow better for our patients, for our staff, make it flow through the organization as smoothly as possible, what would that look like? And begin to look at redesigning the whole system. Again, the current state map gives us the framework to be able to design that future state map, and gives us an implementation plan to be able to look at the low-hanging fruit, the no-brainers that we can get rid of right away, and then begin to look at some of those other issues. There may be things, for instance, in your value stream that we may not be able to change at this point for political reasons or for other reasons. We have physicians that we work with who, they want 5 or 6 patients stacked up in the waiting room, waiting for them for their, so that they're in line. And so we get, there's nothing a lot we can do with trying to eliminate some of the waste and waiting time for those patients in that particular scenario. When we're looking at the future state, we want to make sure we're looking at eliminating as many steps or handoffs as we can. We know the more steps or handoffs there are, the more chances there are for errors. We want to merge steps where we can. We want to create parallel paths. We want to implement pull into flow if possible. Eliminate or reduce batch work, improve the quality, try to create standardized work, and we'll talk more about that in just a little bit. Create more of an organized visual workplace, and again, look at balancing our workload to meet the requirements that our patients need in that particular process. There's 8 questions that we use when we're looking at the value state map. Again, what are the customer's requirements? What do we need to produce in order to produce this finished goods? What kind of inventory do we need? What kind of supplies, equipment? Where can we put continuous flow into place? Where again, it just flows from one step to the next in the process without somebody having to move it to that next step. Can we look at things at single point of scheduling? How do we level the load in the mix so that we're not overwhelmed in the morning where we're doing certain work or testing, and how can we smooth that out maybe throughout the day? And again, what other improvements are necessary to make it flow as smoothly as possible? We want to eliminate the non-value added steps. We want to eliminate long lead times, the queue times. We want to try to eliminate high difficulty levels. We want to look at and making sure that we have accurate and complete information, at least 95%. We want the reliability of equipment not to be less than 95%. And again, looking at quantities or batching work or other long processing times. And again, when we look at all this information together, the steps in the process, the supplies and information we need during those processes, these really gives us the opportunity, what I talked about earlier, the Kaizen burst, where we can do just small, quick changes in the process to help streamline it and create that future state map. Again, with these Kaizen bursts doesn't have to be a big, long process with a lot of people involved. We can really get to those and do those in a very focused, short period of time. We want to, when we're doing value stream mapping, again, we want to make sure that when we're looking at waste, which is MUDA, that really equates to dollars, and you'll be surprised when we look at things in value stream mapping. For instance, the wasted time of motion. When we can refine the process and make it smoother so that we're not wasting motion, that can add up to a lot of money very quickly when you're talking about different techs doing the same kind of procedure time and time again during the day. So we want to make sure we're eliminating that waste, creating the value to our patients, and again, trying to get to the root cause of that waste, not just some of the symptoms. So let's talk quickly about 5S. 5S is a worksite organization tool that we can use to really look at worksite organization and making sure that our particular workstations and worksite is the most organized it can be, so that we can begin to look at creating flow within our workspace and our organization and making sure that we're eliminating the waste by making sure that we're having the best flow possible, the best process possible, making sure we've got the right information and technology and equipment when we need it. And so 5S really is one of the first tools that most people get used when they kind of delve into lean thinking, because it's pretty straightforward and can produce some pretty tremendous results pretty quickly when we look at organizing our workspace and our processes. So again, to be able to do 5S, we need to make sure that our workplace is set in order, everything's in the right spot. We begin to look at the process and making sure we have what we need when we need it, whether it's in a particular department of the hospital, whether it's on the patient floor. And again, this takes a change in culture to make those changes and particularly to sustain them over time. When we're looking at 5S, we're looking at 5 different phases that we go through in looking at work site organization. You'll see the Japanese words there on the left-hand side and really what they mean, which is organization, orderliness, cleanliness, best practice, and discipline. You'll also see these 5 S's as sort, set in order, shine, standardize, and sustain. And we'll go through those, each one of those phases. Sometimes you'll see in healthcare a 6S. You might hear it referred to as 6S, and sometimes people add safety as the 6S in the process of making sure that we're designing our work site and our workspaces with safety in mind. The first 3 phases, the sort, set in order, and shine, are key activities that you need to start and maintain a 5S program and process. And once we get those things underway, then the key really becomes to monitor those changes that we've made to make sure they're continued into the future. What tends to happen if we don't have the final 2 phases in the 5S process is that people begin to revert back to what feels normal, what they're used to. And so any of the changes that we make sometimes revert back to the way it used to be because that's the way people are most comfortable. So the first step in the 5S process is the sort phase, which means basically removing any kind of supplies, materials, tools, paperwork that's not required for the current process. It means getting rid of those things that are no longer used and decluttering our workspace. You know, and while it seems like a straightforward, easy process, it's really kind of an emotional process for people because there's a lot of things that go into keeping equipment or supplies or materials that we need. Because 3 years ago, you know, we used that particular piece of equipment, and we just might need it again sometime in the future, even though we haven't used it for the last 3 years, or 4 years, or 5 years. Or we begin that hoarding mentality that we talked about a little bit last time, where we didn't have that supply that was needed, and the doctor chewed our backside. So we're going to make sure that that never happens again. So we're going to keep things that, or overstock things, or put them in more than were needed. But really the first phase is to really declutter the workspace and remove those things that aren't needed anymore in our workspace area. We should be able to get pretty immediate results in the sort phase. There should be more workspace. We should have a safer environment. We should have more time for patient care because we're not looking for things or trying to look for the things we need in between things we don't use anymore. It gives us more time for value-added work. It makes the product and service flow better. It makes the workplace more pleasant, which should increase staff satisfaction and should supply us with improvements in quality. The next step is to set an order. Once we've got those things we really need to be able to deliver the particular service or what the patient needs, then we go through the process of really setting those things in order. You know, when we go in and work with a lot of hospitals and particularly in the supply area, when we get some new supply or a piece of equipment, where do we put that piece of equipment? Well, generally we tend to put it wherever we have the room for it. So over time, we've got different places that we use and put these materials and equipment that may or may not make sense to delivering what we need to do for that particular procedure or process. We find this a lot in the emergency room. And when we take people through this 5S process, they begin to look at, okay, what are the top 5 procedures or top 10 procedures we do here on a routine basis? Then how do we begin to put those materials or supplies or equipment in the places where we can get to them pretty easily and pretty quickly? So we begin to look at and have some logic in designing where things go and making sure that the things we use most frequently are at eye level so that we can get to them quickly. We'll talk about this in a second, to color code different things. So if we know it's in a different particular color code, we know what that particular, where that is, where that we can get that. So you can see here as the graphic picture shows, we begin to look at and set things in order, which makes logical sense. And what we want to do is make this fairly intuitive so that if people come into that particular workspace area who don't work there on a normal basis, that we build this in such a manner, or that we have visual cues where they can find what they need even though they don't work in that particular area. And so that's the goal we're really shooting for in this particular area. On this slide, you can see actual before and after 5S process that we went through. On the left-hand side, you can see what looks like a typical normal supply area. And then on the right-hand side, you can see what we've done in the 5S process. Again, it makes it much easier to find things, to be able to put them back when you're finished. And again, it cuts down on everybody's looking for particular items that they need. Again, we want to put frequently used items closer to where they're being used than less frequently items. So those things that we may use every once in a while, we may put those either higher or lower or someplace else, again, so that when we need them, they're there, but we give the high frequency supplies and materials priority in looking at that. We try to really prescribe an address for everything to make sure that everything has visual cues so people know exactly where things go, what it looks like, and where things are located. Similar to what we do is, when we deliver the mail. Everything has an address, and we have the labels to describe where that is. Again, we use that a lot in medical records. We use the written labels, the color coding, but those practices can be used in a lot of different areas. And again, when we're being able to cut down looking for different things and being able to access those things more easily, the time savings can be very substantial. And we've seen in a lot of different ways when we've done a 5S process, we've been able to eliminate processing time anywhere from 25 to sometimes 45 to 50% just by reorganizing the workspace area. Again, we can use color codes, visual cues as great ways to address storage locations. So certain things may be in yellow bins, certain other materials may be in red bins or blue bins. Again, it gives a visual cue to people to know where to go to look. We can always use shape as a visual cue. As you can see here in this particular slide, I think this is in a laboratory. They've actually outlined what pieces of equipment are and outlined them on the desk and in their particular shape. Then you also see labels there that say particularly what piece of equipment goes in that particular area. So when somebody comes on, for instance, on their shift, they can do a visual cue of their workspace and be able to tell right away where something is not located where it should be. And I'm sure that's vastly different than a lot of your places right now where you couldn't, a lot of places we work and go into, they can't tell if something's missing or not until they actually need it. And again, this is what we're trying to do in 5S and setting things in place. And again, it helps us to make sure that places, equipment, and material supplies get put back where they're supposed to be when they're done using them. And that's where we find the biggest hassles are, is that when people get done with a particular piece of equipment or supply materials, then they're off to the next thing and they forget to put it back, and then the next person is trying to hunt it down and find that particular piece of equipment or materials. The set in order phase really gets to the heart of wasted time and motion because our supplies are where they need to be. They're easy to access, and hopefully we put them in a position where we're not, again, running all over. They're in a sequence that we can use to get the particular task or process done. It also helps when we do this and set things. We use another lean tool called Kanban, which helps us control quality or quantities and effective labeling, and really helps with inventory control, which helps decrease waste and raises overall productivity when we go through this kind of a system. When we do the shine, which is step 3 in the 5S process, again, we're looking at getting our area clean and well maintained, and making sure that every corner of the work area is free from dirt and grime and other things, and we keep a clean workspace. Again, the shine process is really not just to the housekeeping staff, but everyone, to make sure that their workspace is being kept in the most cleanly way possible. We found that when that happens, when that workspace is kept up and is shining, it increases performance, quality, staff and patient satisfaction, and workspace satisfaction. The next step in the process, and the 4th step, is to standardize the changes that we've made and put controls and checks in place to make sure that the practices that we've redesigned stay in the process. And again, excuse me, I just lost it again. Oh, I'm back on. Thank goodness. Okay. So the standardize really helps us put in processes and procedures in place so they become a daily habit. So we build into, for instance, in the ER, if you're coming on shift as an ER nurse, one of your duties is to go in, do a visual scan of the room, make sure that there's nothing that you're lacking as you go on the shift. And so that's how we begin to standardize the process, begin to build those things in the regular duties of people so that we can make sure we don't degrade back to what we did before. And we build those into standard operating procedures, again, as I mentioned, to build that redesign of the workspace into the regular standard operating process. And again, we look at visual controls as a way of maintaining those things so that we can look at abnormal and the normal conditions at a glance. When we have doors or cabinets that are covered with a door, it's a great place for people to throw all kinds of things. And so we've had people take those doors off or move to cabinets that have glass fronts so that we can see exactly what's in there. So let's talk about A3 problem solving, which is another great Lean tool that I find very useful in working with hospitals for a variety of different reasons, and we'll talk about some of those reasons here in a second. A3 problem solving really is trying to close the gap between what should be and what reality is, and trying to have a standardized way of looking at how to problem solve throughout the organization. One of the reasons that I think problem solving is more difficult in organizations such as hospitals is that we can come at those problems from so many different angles based on our perspective, based on our place in the process. A lot of folks in the front line don't feel like they have the ability to solve problems, even though they can see them on a daily basis. And so A3 problem solving really gives everybody a common way to solve problems. Again, it allows us to have a standardized methodology to solve those problems so that it's not so intimidating to people throughout the organization, and creates a common language amongst people in the organization on how to solve problems and what steps need to happen in that process to be able to do that. Again, why problems aren't solved in hospitals. We see different departments see it from different angles. Too many times people leap to a solution rather than really looking at what the issue is, the root cause. And so we put solutions on symptoms instead of solving the problem, the root cause. We solve problems and then we're off to the next thing, what we call putting out the fire and then going on to the next thing, thinking that we solved the problem when we haven't. The solution is implemented but isn't managed properly. When we put a solution in, and do we go back and track that with metrics to make sure that it's solving the problem it was intended to solve? Again, a lot of folks don't do that, and A3 problem solving really builds that into the process. And again, helps us shift back to making sure we sustain the gains over time. What we found is when we look at developing a A3 problem solving structure throughout the organization, we get team problem solving, which, as we talked about last time, anytime we can put 2 or 3 heads together or more, we're going to come up with better solutions to the problem because we're getting different perspectives. So this structured approach really helps in creating better thinking in our organization, creates better understanding of the problem, creates better communication of the problem, and consensus of what the problem is and how to solve it. It also creates more ownership when people in the front line can be part of developing and looking at problems and implementing solutions to those problems. And again, another thing I really like about A3 and this problem solving approach is the learning that the organizational learning that can happen through this process, because as you'll see with the A3 report, we have a short, concise way of documenting the problem, going through the process, and we can begin to share that throughout the organization. And when we solve a problem in one area of the hospital, it doesn't mean that we can't share that learning with other areas of the hospital, and so that they can improve their processes or learn what we've learned from solving that particular problem in that area. The advantage of team-based problem solving is those closest to the work really know how to perform their job the best, how to improve their jobs. We get a broader range of knowledge from multiple disciplines. We get broader, more creative solutions. We talked about earlier, when you're the one making the solution or recommending the solution, you're not as likely to take risks in case that problem doesn't work and it comes back on you. When we have a team approach, we have broader, more creative solutions. We have better chance of risk taking, and teams tend to be more successful in implementing more complex plans when they use this team-based problem-solving approach. And again, as I mentioned, we have a higher level of ownership in the results. So A3 really is a perfect way, a perfect tool to facilitate that team-based problem-solving and helps by ownership and buy-in of the process. Typically, A3 processes are made up of 3 to 5 people. They're process owners, and they have a stake in the problem that we're trying to look at. We also need a good cross-sectional representation. And again, this allows people who are closest to the problem to have the greatest impact. And while the A3 report and the tool is just part of this issue, really developing this culture of A3 thinking and developing this new culture of problem solving is really where the benefit lies in this particular tool. So what's under that iceberg? A3 problem solving helps develop a continuous improvement culture, that people are constantly looking at ways they can solve problems, that they're encouraged and to solve problems when they see them, not to wait till they're told by their supervisor to solve those particular problems. It helps break down the silos. Again, helps us free us from the freedom from failure, and helps provide a mentoring mentality. Again, we can work and mentor people to help solve problems around the organization. Kind of the keystones in the A3 process is developing the problem statement. Again, we want to directly observe, do the Gemba walk to see actually how the problem or the process is working. We want to make sure we know what target we're doing by using SMART goals, looking at once the problem's creating an action plan, and then validation and standardization of the process, making sure that what we're putting into place as a solution is actually solving the problem. And as I mentioned earlier, we use a lot of tools, a lot of the Lean tools. And so here's some of the list of other tools in Lean thinking that we use in the A3 problem-solving process. The A3 report is really, there's no magic in why it's called A3. It's the ledger size of paper. It's the international code for ledger size 11 by 17. So one of the, I think, key aspects of A3 problem solving is the whole problem is on one sheet of paper. So people can begin to get a visual, really get a visual cue of exactly what the problem is and the steps in the process. For those of you that are familiar with Plan, Do, Check, Act, you'll see A3 really follows that particular path or that methodology. As you can see here, this is a A3 problem solving structure, and it really follows the Plan, Do, Check, and Act. On the left side of an A3 really clarifies the background, what the current condition is, again, what our goals are, a problem analysis. Again, when we have such a small area that we're using, just one sheet of paper, we have to be really clear and concise about what the problem is, what the issues are, and really boil that down into meaningful language that's relatively short in nature. On the right side, we have the countermeasures, the things we're doing to solve the problem, the effect confirmation, what our countermeasures are working or not working, and then who's responsible for the follow-up, what steps do we need to do, who's doing that, when, and by what date. So let's take a look at an example of an A3 report. Again, you can see here's the full A3 report. Going through, again, we talked about the background, current condition, goal, root cause analysis. On the left-hand side, we see the countermeasures, the effect confirmation, and follow-up action. So let's take an example and look at a particular problem that we're having with one of the employees being tardy. So the theme is reducing this particular employee's tardiness. And again, we use bullet points to really describe what the problem is. Jeff had a good on-the-job record, and then for some reason he began to have more and more tardies. So we again set the stage of what's going on, why is it important, how do we link this to our strategies. Again, and we use visuals to see, as you can see on the right-hand side, we have the number of tardies by quarter for Jeff, and so that gives us a visual understanding of what's happening. What the current condition is really kind of looks like what we did in the value stream map. We began to look at visually what the issue is and where the problem particular is. How are things being done now? We clarify the problem. And again, we use visual to outline where how this particular portion of the process is being a problem. Then we establish our targets. We want to reduce his tardiness from 12 times per quarter to 1. So that would be a 91% reduction. So we see Jeff's old rate, his current rate, and the target rate. So again, we're defining how success is going to be established, how we're going to get there, what the standard is we want to achieve. And again, using visuals is a great way to communicate. Finding the root cause, again, this is where we do the detective work. We find the underlying cause. We collect the data here to confirm what our assumptions are. And again, we begin to look at contributing factors. The old coffee shop closed in March. A new coffee shop opened closer to home. And we begin to see that Jeff was stopping by the coffee shop and being late or tardy more often because of that. So the next one is the countermeasures. So we're going to work with Jeff to take action, to set the countermeasures on solving this problem, and clearly stating who, what, when, and where, and making sure we're adding our results. So in the effect confirmation, we want to track this tardiness over time and make sure that our countermeasures or the things we're put into place to solve that problems are working and they're matching our predictions. And again, using visuals is a great way to see it, make sure this is happening. And again, we see in July, August, September, October, through that 4-month period that Jeff's tardiness is beginning to come back down to where we want it to be. And then closing things out is just making sure that we got follow-up actions, that we're meeting with Jeff, we're making sure that it doesn't slide back into the problem again, and again, how we can spread any learning we have in this particular problem that we solved to other areas of the hospital. So again, when we write these A3, we want to make sure we're using bullet points, we're using an active voice, we want to make sure we're writing to the audience we're trying to get to, and we highlight and keep bold bullet points. And again, visual is huge in looking at the A3 problem solving. We're looking at, on the left-hand side, how to install and assemble a piece of Lego. And on the right-hand side, we see the visual cue. When we do the left-hand side without the right-hand side, and I'll send this out when we talk about standard work, it takes most people almost 15 to 25% more time to do the same thing when they just have the written instructions versus having the written instructions and having those visual cues. So those are really important when we look at problem solving. Really, A3 problem solving is helping people adapt to change and finding a structured way to be able to look at change, make change, and change problems, and identify those problems, and solve those problems on a more quick basis. It's really easy to learn, to teach, and to coach, and it's really one of my favorite lean tools. And again, it provides the organization with a consistent way to solve problems, and when you do that, it becomes incredibly powerful in the organization. So let's move on to standard work. So let me ask you a question. Would you add eggs to an omelet before cracking them? Would you serve multiple meals to your family? Would you let too many cooks in the kitchen, as they say, spoil the soup? Of course not. You wouldn't do those kinds of things, and that's what we're looking at when we're looking at standard work. The best reference or word picture I can give you is to think of standard work as a production recipe. And what we do is we cook things based on need. So we have a set of inputs, a set of things we need to put in the particular thing we're cooking. And then we have a particular way of doing that, a sequence that if you don't follow the sequence, you're not going to get the outcome that you want. So we have precise ingredients in our recipe, and we have a defined sequence to add those ingredients together to get what we want. Standard work is probably one of the least used lean tools, but probably is the most powerful one of any of them that I've seen. Really, standard work is looking at how we can describe an acceptable way to perform a process, or a task that's done consistently each time, each and every time. That it really narrows the variation in how people do that piece of the process or that task. What we find when we go into lean, when we do lean work in organizations, what we find is because a particular process or task is not done the same way every time, that it varies person to person, may vary from day shift to night shift or during the week versus weekend, that it's almost impossible for us to come up with good solutions to try to solve that problem because there's so much variation in the process. And what we want to do with standardized work is be able to narrow that down to make sure that regardless of who's doing this task, whether it's various different employees or different departments or night shift, day shift, whatever the case, is that we have a standard way to do it that's in a standardized format. Again, with the absence of standard work, continuous improvement is really not possible because we can never have a process that doesn't have variation in it. And again, when we get variation in it, that's when we begin to have more waste and inefficiencies in the process. So standard implies, when people think of standard, they think of something fixed and inflexible. And really what we're talking about is standardizing, and it really should reflect a spectrum. And we have to ask, what is it that we want to standardize, and to what degree do we want to standardize it? Not everything in the hospital, every process needs to be standardized. But some of the processes that are vital to providing patient care actually really do need to be standardized, and they need to be followed the same way every time. Standard work, the definition really is describing the sequence of activities needed to accomplish a specific work in a specified time, and each task that's required to accomplish that specific, and that it's performed in accordance with the patient or customer demand. Standard work is the most effective combination of activities that minimize non-value-added activities while providing high-quality care. And I need to mention that standardizing isn't the goal, but the goal really is better safety, quality, access, cost, staff morale. That's really what we're trying. I'll finish up the standard work portion of it because we're coming up to the end of the 90 minutes. And what I'd like to do is, since we're running behind, is I will contact each one of the hospitals and the team and set up a time where we can finish the discussion on Kaizen and go over the projects and have some more time for questions and answers on specific tools that you're going to be using here in the next 60 days. Most likely, most people will be using either a 5S tool for their project or maybe the A3 problem solving. So I don't seem to be able to get back up. So let me finish off with standard work here. If you could advance to the slide that shows, I think it's the combination form. Basically, what we're trying to do in standardized work is to get past, I think, what we generally do in hospitals right now, and that is we have large procedure manuals that most people don't follow, and get back down to this concept of a shorter 1 or 2 page, maybe 3 page, standardized work process combination sheet. And what that combination sheet does is shows the critical tasks that have to be done for that particular procedure or portion of the process. It also puts in the time sequence. How long should that particular steps take to be able to accomplish that? And then looking at what sequence those particular steps have to do. And then looking at the visual cue that we talked about before of visualizing exactly what the steps in that process is. In the handouts, you'll see I included an example from a hospital that shows kind of the standardized worksheet. Generally, what we're trying to get towards or get to is what they've done in aviation. Whenever a plane gets off the ground, the pilot goes through a checklist of certain activities he has to do in a certain sequence, and he does that each and every time. Regardless if he's flown that same plane 5 times, he goes through that same process each and every time. And when you begin to do that, you begin to have standard work. And when you have standard work, then you begin to really drive that quality up. You begin to be able to identify where there's variation and how we can do that and correct that variation. And so that's why standard work is probably the most difficult to do. But when it's done, when we can get in and work with organizations and get that accomplished, we see really breakthrough results happen because they're standardizing those particular processes that are critical to the service lines they're providing in those hospitals. And so that's really the basics of standardized work. It's usually work that's done after we do things like 5S or A3 problem solving or doing a value stream mapping. Again, we look at how do we take what we've learned, how do we make the changes we want to happen to better suit our customer and our patients, and how do we standardize that? How do we lock that and hardwire that into place so that it's being done the same way each time, regardless of which employee is doing it. And again, that's the essence of standard work in the hospital. So with that, I'm going to stop at this point and apologize again for the technical difficulties. I'm not sure where they're at on my end, but I apologize for that. But what I'll be doing from here, since we haven't had a chance to really quite finish, is I'll contact each one of the hospitals that are in the program here within the next day or two. We'll set up a time so that we can have a conference call and go through the concept of Kaizen, that small incremental changes, and then we'll have a better chance to dialogue about your projects, some ideas, bounce things off each other. You can ask me questions about the different tools that we weren't able to get to today. So expect a call from me here in the next day or so to get that lined up, and we'll move forward that way. That's it. I think to respect your time, it's 2:33, which is 90 minutes. So I want to respect respect that, and hopefully we've come up with a solution here to go forward with this project and hopefully be able to meet your needs that we weren't able to get to you today because of the technical difficulties.
Thanks, John. And I just have a link up on the screen for an evaluation for today's webinar. You can follow the SurveyMonkey link. Also, I was recording today's webinar, so I will post the recording and John's slides on Moodle, so you can access it at any time. And then, again, John will be contacting all the hospitals to talk about Kaizen and project ideas. So thank you, everybody, for participating today, and have a great day. Thanks, John.
Thank you.